Weight loss, lower blood pressure, less fatty liver disease, lower blood glucose. So many positive, life-changing results from both bariatric surgery and weight loss medications. But what about the changes, the possible disruptions to relationships that typically are not mentioned or discussed before surgery or before you start on a GLP-1? Changes like upheaval in a marriage, changes in sex, intimacy, boundaries. When one person changes, the unspoken contract that exists or the status quo changes too, where one partner may feel, I don't recognize my partner. In fact, I need a roadmap. Well, don't go anywhere. Bariatric psychologist Dr. Connie joins me to talk about these changes, how to navigate them to a stronger relationship. You don't want to miss this discussion.
Do you know what's in your vitamins? ProCare Health does. Made in the USA, it's certified facilities. Each batch is independently lab tested to ensure purity and potency. Why settle for less when you can have the most affordable, high-quality vitamins delivered to your door? Visit ProCareNow.com. Use code BSS10 to save 10%.
I'm bariatric dietitian Dr. Susan Mitchell. You're listening to the Bariatric Surgery Success podcast. I'm so glad you're here today, and I'm really excited that Dr. Connie's here too. It matters where you get your nutrition information when it comes to bariatric surgery and also to the use of GLP-1s. Nutrition is specific. You're in the right place, friend. Let's get started. Joining me in the studio is Atlanta-based bariatric psychologist, Dr. Connie Stapleton. If you're a regular listener, you already know that Dr. Connie is the real deal. When she shows up, she brings her A game every single visit. And what I love about her, she doesn't hold back with what she thinks. And she shares her vast experience in the mental health aspects of bariatrics. Don't forget, you can find her information, Dr. Connie's website, her books, as well as her podcast called Bariatric Care in the show notes. Well, hello, Dr. Connie.
Hello, Dr. Susan. We always have fun together.
Oh my gosh, I'm so glad you're on today. You know, recently we were talking about this. There was a very interesting article in the New York Times about weight loss drugs, GLP-1s, obesity medications. They have several different names, and how they can turn a marriage upside down, or a friendship too. I'm going to say a partnership. When someone considers bariatric surgery or they consider the GLP-1 medication, there's discussion typically about the physical changes. You can expect how much weight you're going to lose. Maybe the side effects, which, by the way, with the weight loss drugs should be discussed up front because they affect almost everyone. But why, Connie, why is it that mental health changes, and here I'm including relationship changes, whether marriage, friendship, partnerships, changes in how you see and feel about yourself, all of these issues rarely get addressed before you make a decision? Why? Why is that?
That is an amazingly great question. And I'm going to give you two, a focus on the patient side and a focus on the professional side. And people who are struggling with weight, I understand. They want this weight off. It's been a monkey on their back and literally weight on their body for a long time, a lot of these people. And so they're thinking, I want this weight off.
Yeah, get it off.
Makes sense, right?
Right.
They're not thinking about the greater scheme, although fortunately there is more talk about that these days. So that's a good thing. But their focus is just, I need to feel better. I got to get this weight off. But professionals, on the other hand, they're the ones that need to be bringing this up. But here's the deal. They all have, or I should say we, not all, but a lot of professionals in the weight loss arena are focused. They have tunnel vision on their specialty. Yeah. So while there's promotion maybe about this multidisciplinary approach, that's often not the case.
I would agree with that.
The medical doctor, the surgeon, they're like, this is about medication. This is about medication. And those of us in the allied health fields are like, this is a whole person you are treating.
Right.
They have to know about nutrition specific to the medications or
Oh,
specific.
absolutely. You have to know if you don't have
Yes,
any appetite or what to do if you can't poop or you feel like you're going to throw up and you do. I mean, what about the
exactly.
muscle mass losses? There is so much to know. And
Absolutely.
for you, my goodness me, the changes in all about yourself, they're huge.
So, for your listeners, understand you are a whole person and your whole life is going to change, and you're going to need guidance from peers and professionals.
I agree. I want to really dig into this important issue of how you behave differently after weight loss, the mental changes that go along with the physical changes,
Mhm.
then how that changes how you act and interact with others. Tell us about this from a broad standpoint first.
Okay, I will. And I want to note that I have a very, very, very important caveat along with this information. So people do act differently after they have weight loss in a lot of positive ways.
Mhm.
So there's a boost in physical energy, right? Their mood is better. They're seeing results. It's like, finally, some of this weight is coming off. I feel better in clothes. The clothes size is decreasing. The scale is decreasing. My health is improving. All
It's a
these
wonderful
things.
thing.
It is. And
It
they're
really
doing
is.
things that they weren't able to do before.
Right.
And at this stage of the process, there's usually motivation to continuing these healthy lifestyle behaviors because they're seeing this weight loss. So
Right.
we see this increase in self-esteem. Now, this may be a temporary thing,
Yes.
or it may be longer lasting, depending on the issues a person might bring into the situation before they lose weight. But here's the caveat. And I say this with a sad heart because while it's true that other people, and we're going to talk more about this, I think, other people, as in the public or those who don't carry extra weight, often have this negative opinion about people who carry a lot of weight, right?
Yes. Right.
The sad thing is the person who's losing the weight does the same thing to themselves. And to me, that's more important because,
What do you mean exactly?
well, you need to be more mindful. Your attitude changes. So, what was your attitude about yourself before you lost weight? Your perceptions about yourself change. You know, instead of worrying about how other people treated you and saying, oh, it's so bad, they treated me so badly, think about how your own behavior is changing. You're more assertive now. You're doing things. You're holding your head up. What was going on that you treated yourself so badly and called yourself negative names? We can't control other people, but friends, we need to look in the mirror. So, yes, people change, and often it's in a good way. But you got to look at this in terms of who am I facing in the mirror and what's going on? Why am I treating myself better now? Why didn't I like myself before?
That's a very, I'm glad you're saying that. Why didn't I like myself before? And why am I feeling different now? And is that something that you often see in counseling that comes out and has to be worked through as the weight loss continues? Does it typically get addressed?
I address it, but I will tell you, people don't look at it that way. They look at how others treat me. They're not looking at how I treated myself and the fact that I too am treating myself differently. And I think this is something that people who are losing weight really need to focus on because you can't control what other people think, feel, and yeah.
Right. And say and do and anything else. This ties in. I was thinking about some clients that have told me that their bodies change faster than mentally they can accept what the changes are and keep up with it. Do you see this? And if so, in what way?
All the time, all the time, all the time. And it makes so much sense. If I had long hair that hung down to my waist for 30 years and I cut it off to where it is now, I have super short hair. I'd look in the mirror and have to take a double take for a long time before I get used to that and recognize myself. And that's what happens as people lose weight. They don't recognize themselves. And people call this body dysmorphia. And I'm throwing this in there because that's not what we're talking about in the vast majority of the the cases. And so anytime I have an opportunity to educate people, do not talk about body dysmorphia. It's distorted body image.
Yeah. Big difference.
Big difference.
Can you just take 1 second and tell the difference so people go, well, how do I know what is the difference?
Yeah. Body dysmorphic disorder is a very serious mental health condition that takes up to 8 hours a day of a person's time, where they're focused on a oftentimes non-existent physical issue. It's not dealing with the changes in your body. That's body image distortion. You don't see yourself the same. Body dysmorphic disorder has the highest rate of suicide attempts associated with it than any other mental health issue. So and it only affects a tiny bit of the population. But this changing body image affects almost everybody who's had weight loss surgery or is losing weight through GLP-1s very quickly.
Okay, thank you for clearing that up, because I'm sure that will help people go, okay, that makes more sense to me. What are you having for dinner tonight? Do you need some quick ideas? I'm a big fan of sheet pan dinners. I make them often using salmon, shrimp, chicken. This past weekend, I did one with shrimp, carrots, and asparagus. So I have this little raised bed garden. And for the first time, I've actually grown some carrots, and I use those carrots in my sheet pan dinner. So it was really a lot of fun. But you can try easy sheet pan dinners too if you want. I'll put both the link to this freebie in the show notes, so you can go get it right now at breakingdownnutrition.com/sheetpandinners. So, Dr. Connie, as you physically change, do you think boundaries and the way you respond to others also changes? And again, there's rarely a conversation before you have bariatric surgery or before you start on GLP-1s that says, hey, you're going to feel different. This is going to mean changes in us, whatever that us is, whether that's friendships, a marriage, whatever, and other relationships. Talk about that.
Yeah, and I'm going to carry that theme from what I said earlier into this. So as we talked about earlier, as people lose weight, they start to feel better about themselves. And like other people, start treating themselves better. And part of that is saying, you know what, I don't have to put up with this. Please don't talk to me that way. Please don't talk to me about my weight. People feel more confident to set boundaries in themselves. So my question to people from a mental health perspective is, what was going on with you that you didn't do that for yourself earlier? Because a lot of times people will say, why are they treating me differently? I'm the same person I was then. Why are you treating yourself differently? Why are you treating yourself differently? So let's look at what issues you had before, because they're likely to catch up with you, even though you're feeling really great about yourself now. Those issues are still there for most people.
And is there a correlation between people that are bullying and shaming those that are overweight and with the way you start to see yourself? Do you start to believe that negative input from others and then take it on yourself and say, you know what? I must be this or I must be that. I'm hearing it enough. So is it part that, or does it also exist on its own because you don't like what you see?
I think it can be either or both, right? So if you grow up overweight as a child and people are constantly criticizing you and bullying you, of course you internalize that. And so we take those internalized messages and we start saying them to ourselves. So partly, I would say almost always, our negative statements about ourselves started externally at some point, or we interpreted those things that other people were saying and doing. And so we become our own worst enemy. So it's easier to get angry at other people who do this. Quit bullying me about my weight. Society, quit talking to me about, quit treating me badly. Absolutely. And there is truth to that.
Yeah.
Treat yourself kindly and give yourself some compassion for the fact that you treated yourself badly before as well. But come to understand that this is a you transformation. And you need to look at the fact that sometimes people continue to talk to themselves negatively. And this is something that's got to change with the weight loss process. Or people oftentimes revert to those same negative behaviors. Because if I'm telling myself negative things all
Yeah.
the time, I'm going to treat myself negatively, because thoughts and
I agree
behaviors
with
go
that.
together.
And I like what you just said. This is a you transformation. Absolutely.
Yes.
So I've heard that other partners in a relationship, they often feel blindsided or even left behind and forgotten, which can cause more strain in a relationship. And I can see how other friendships would be affected too. You know, the party friends, if you were a partier before, or the foodie friends, if you went to eat all the time at certain places and now you're not doing that. Whatever it is that you may now do differently, how do you navigate these changes as to keep healthy relationships?
Yes,
If you can keep them, some of them you may not. I don't know. That's what I would
true.
wonder.
True. And it boils down to, I believe, and assuming we're talking about adults here, because I think kids are a different situation, but if we're talking about
Mhm.
adult relationships, for you and I who've worked in this field for a long time, it comes as no surprise. But for those who may not have a breadth and depth of information about these changes, it is absolutely blindsiding. Now, if we have two adults who are equipped to deal with conflict or difficulties in situation, who have healthy communication skills, it can be worked through fairly easily. The problem
Yeah. Yeah.
is most people don't. Most people are not equipped, because we're not taught as we grow up
Yeah.
to deal with conflict in healthy ways. We haven't learned these healthy coping skills. People engage in defensive behavior or sarcasm, or they say, you always do this, or you never do this. And we point the finger and we blame
Right.
and accuse. So that's where the bigger problem is. If people could communicate about it in terms of, this is what I'm experiencing, this is how I feel. I feel left out. I feel scared that you're going to go off and leave me. I feel frustrated. I feel left behind. But it's like, you're always out with your friend. You don't care about me. You don't. And so we don't communicate well. If people had healthier communication skills, it would be so much easier to deal with these absolutely common issues that come up in relationships, because people
So they
do
need to
feel.
find counseling or communication, whether that's going to be through
Yes.
one-on-one counseling, through a
Yes.
church group they might be in, through something.
Yeah,
Where,
Google.
what kinds of things would you recommend if they see that it's becoming this negative, highly charged
Emotional.
interaction
Yeah.
versus good communication?
On my podcast, I have several series of communication episodes about assertive communication, sarcastic, passive aggressive. So, or read about it. It's everywhere. Just learn
Yeah.
about healthy communication skills
I think
in
that's a great
relationships.
idea. What about this? There's also an anger, I think, an anger at, I'll just call it the world at large,
Mm-hmm.
because you may be treated differently now than you were treated before you lost your weight. You're not being shamed or bullied. But inside you probably feel anger. You probably feel good in one way because, oh, look, people have noticed the change in me. That's a positive thing. I've lost weight. I feel good about it. But then there's a potential for anger where you go, you didn't treat me this way before. You
Yeah.
bullied me, you shamed me. How do you proactively navigate that anger?
First of all, I want to affirm that this is a reality. You are warranted in your feelings. They're reasonable. Other people do treat people of weight or really short people. My daughter was talking about how that's a discrimination in the work field, and research supports that as well. So it's warranted, and your feelings are reasonable. So talk about it, talk about it, talk about it. But I'm going to sound like a broken record here, because do we have any influence over, like you just said, what people think about us, how they treat us? No, we don't. We only have influence how we respond and react to that. And I think it's more important to look in the mirror and say, how am I treating myself differently? Just like society is treating me better, I am treating me better. Just like society bullied me, I bullied me through my own self-talk. Because we can change these things. And it's so much easier to blame other people and be angry with other people. And like I said, yes, that is warranted.
Yeah.
But let's look in the mirror because that's where the change can take place.
So kind of carrying that on just a little bit more as we wrap up, I think that is so important what you're saying. What would be your most helpful strategy or strategies? And as you're talking about looking at yourself and how you treat yourself to move ahead in a positive, healing way with yourself and then your relationships.
Yeah. First of all, be open-minded and ask yourself, what's my part in this? What's my part in this relationship with this other person, my friend, my partner, my children? What can I change societal wise and within myself? So get to know yourself and be willing to look at what you need to do for you. A, to change how you feel about yourself, and B, how society deals with it. And understand that this weight loss process, it exposes insecurities, fears, unresolved stuff. So get whatever kind of help you need. Get the nutrition counseling, get the therapy, get the coaching, and take responsibility for yourself. I end all of my stuff with it's your health, which makes it your responsibility.
I love it. Always great information, always realistic and usable. Thank you, Dr. Connie, for sharing your valuable time with us. We so appreciate you.
Thank you, Dr. Susan. Continue to do good work, right?
That's what we'll do our best. Well, here's what I want you to do this week. You just heard what Dr. Connie said. So if you have a strained relationship that's really important to you, consider, how is your communication? What are your communication skills like? Read, do the homework Dr. Connie was talking about so you can work to improve those. And then go that next step that Dr. Connie said, where you start to look at your relationship with yourself and what's going on with you and how you treat yourself, because you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.